Very much for your important and informative remarks. This is a serious crisis, and you are attempting to deal with it seriously, and we're just going to have to work together and share the ideas that we have as best we can. I am especially delighted in response to Mr. Lantos, your strong commitment to significantly improve our public health system. I have always believed that it is a national disgrace that as the richest country on earth, 44 million Americans have no health insurance, and many more are inadequately insured. But given a healthcare crisis as a result of a terrorist attack, I remain concerned that there will be many, many millions of Americans who will not know where to turn, that there will not be healthcare facilities in their community that they can access. Now, during the campaign, President Bush, candidate Bush, then talked about federally qualified health centers, which seemed to me to be an extraordinarily cost-effective mechanism, not only to provide health care to all Americans, but to deal with this crisis. I come from a rural state, and there are people who live 100 miles away from a hospital. They may not know who their doctor is. It would be of real value to people all over this country to know that there is at least one healthcare clinic in their area that they can walk into regardless of their income and get care during an emergency, get the medicine they need, etc. I would hope that in the midst of this crisis, we raise again the issue of federally qualified health clinics, and we adequately fund them, and we set them up in every county in the United States. Second of all, let me reiterate my concern about the power of the drug companies. It is no secret, I think, as you may well know, that the pharmaceutical industry is the most powerful lobby on Washington. They always win, which means we end up paying the highest prices in the world. Now, I understand that Bayer has indicated to you that it will take 20 months to produce all the Cipro that you have requested. Yet the FDA has tentatively approved 5 generic manufacturers to make Cipro, and they have indicated that it would take 3 months to produce the same amount. And I wonder if, in a moment, you can comment on that. Why we would not go with 5 companies who could produce what we need in 3 months rather than Bayer in 20 months. The last question that I wanted to ask is the following. I think, as we have all indicated, nobody here is happy about raising nightmarish situations, but it is important that we get it out on the table, and we do our best to be able to respond. Let me throw a nightmare at you. I am concerned, and I would like, I hope that the people can tell me that my concerns are not justified. I fear very much the possibility that on some windy Saturday morning, a half a dozen small Cessnas will take off in different locations in this country, each with a couple of 100 pounds of anthrax, and that simultaneously they will be released. And if that is the case, it would mean, given the weather and the temperature and the wind, that tens of millions of people could be exposed to anthrax. Now, my question is, go through that scenario and tell us our capabilities of responding. For a start, as I understand it, the good news is that if we know we are exposed to anthrax, we can treat it with antibiotics. That's very important and very good.
That's true.
How will the United States government, while local public health authorities, be able to tell the American people before they develop the symptoms, guess what? We've got a crisis. Get to the hospital. Get your medicine right away. Do we have that capability to detect anthrax in the air? Do we have, you asked for 12 million doses, as I understand, for Cipro. Maybe you could tell us why 12 million and not 100 million, and so forth and so on. But I fear, I appreciate that's a nightmarish situation, but all over this country, every health resource strained to the utmost degree. Can we and are we moving to try to deal with that scenario, understanding that the good news is, if we have our act together, that we can perhaps minimize the death and suffering that might take place, because, as you have indicated, anthrax is treatable if we get to it soon enough. So those are I wanted a specific response, if you could, about Bayer in 20 months as opposed to the other companies, federally qualified health clinics, and this nightmarish scenario.
Thank you very much, Congressman Sanders. Let me try and go through many of the things you said, and then Scott Lillibridge will want to respond, and I'm sure Tony Falchi will as well. To your nightmarish thing that hopefully will not happen. First off, in regards to community health centers and federally qualified centers, as you know, the president put in his proposal enough money to increase that from 2,200 to 3,400, an additional 1,200, and go from 11 million people to 20 million. In regards to every county, I am not opposed to that. And as you can probably recognize, I think that is a way to deliver good quality health care in America. And also coming from a rural area, I know the importance of community health centers and federal qualified health centers. So I recognize that, and whether or not the resources are there, whether or not Congress is going to pass it, I don't know.
But you recognize this is a very cost-effective way to provide quality care.
It's one of the best, and I think it is. And I think they get very good quality health care there. I've spoken to and been involved in raising money for them personally, and have been very much involved in them. It's a very cost-effective way to...
And they could play a role if, God forbid, we needed...
And they could. Secondly, I want to point out that, once again, you know, how do we notify people? What we do is we have 7,000 medical professionals throughout the United States divided into 90 teams that we would move very quickly. We have CDC sending out epidemiologists, and we would have NIH. We also have our Commission Corps if it was a vast thing, and we would be able to call those people up within hours. Yes,
Mr. Secretary, here was my question, and can one detect anthrax in the air before one develops a symptom? In other words, the problem would be that if it takes you 3 days, by the time you get the symptom, you've got a problem.
We haven't been able to determine that.
Are we working on trying to develop a mechanism?
Yes, we are, but we haven't found it yet. But the third thing is that in regards to Bayer, which you were concerned about, I'm not here to defend Bayer. I'm here to tell you that I'm negotiating with them. And once the negotiations are done, I would like to sit down and show you what we are. They have indicated to me that they can provide 200 million pills within 90 days, and they can adequately ramp up and produce it within weeks, whatever we need. But the price is the question, not the supply. And that is something that we're going to be negotiating and debating, and I can assure you that we are not going to pay the price that they asked.
Let me ask, am I incorrect in saying that they have told you that it would take them 20 months to produce all the Cipro you have requested? Am I correct in that?
I think you're wrong, because they told me they could produce 200 million pills within the next 60 days.
All right, and if you are unhappy with their performance, either in terms of speed of delivery or in price, are you prepared to go to generic companies?
I am prepared to ask Congress for that authority.
Okay, you know the Canadians have done that?
I know, but I know that we have a different law than the Canadians.
Okay, but you are prepared if Bayer does not cooperate with you to do that?
Yes, I am.
Okay.
And now the third thing in regards to your nightmarish thing, let's hope it doesn't happen.
Right.
But I think Scott Lillibridge is better able to do that.
Sir, let me make a few comments. First, as we've gone to this new kind of war, we've developed a game plan. We've developed this game plan as we've refined it over the past couple weeks. And let me just tell you what's emerging in this. While we had a basic public health commitment to build infrastructure in certain areas, we've been on that for the past 3 years. We've also been readying our clinical response. Let me tell you some of the key elements of this game plan. They're clearly prevention, and we are networking with the intelligence community to try to interdict, understand, get early warning about such events. And we do that on a daily basis.
You get early warning in other ways than you're suddenly seeing a rash of illness in a given community and say, we've got a problem. Can you get early warning in other ways before that?
You can. You can get early warning in terms of helping you gauge your likelihood of prioritize your efforts in one pathogen versus another. You can get early warning in terms of where to put your resources, and you can get early warning to put your detection out and look in certain areas. We are working with the intelligence, law enforcement communities on a daily basis and coordinating in a way we haven't done before. Second part of the game plan is clearly detection, early detection, and that involves clinical awareness, picking up cases, sentinel networks for surveillance, laboratory kinds of information. Third area of the control is disease control, and that involves the steps to corral and contain the disease, keep it from spreading in the population, interdicting steps like prophylaxis.
Would you agree with the Secretary that at this point there is no way of doing air detection and knowing if there's something in the air?
Sir, currently, my understanding is that real-time technology to detect aerosol salt is really not available.
Is that something we're working on?
It is something multiple agencies and departments are working on in a collective fashion.
What I can address, sir, is the research component of it, what we can do in the future for having capabilities of detecting. There are obviously molecular means that are research tools right now. Can you detect a microbe by having what we call a microchip that might be able to determine if there's a certain concentration in the atmosphere? That's in the research phase right now. That is not going to help tomorrow or the next day. From the standpoint of research related to better ways of addressing anthrax, I think it's important to bring out, because Scott mentioned the public health components of it very well, and I can't add to that, is that the research that's going on right now is trying to address much more specific ways to combat the anthrax microbe over and above the question of antibiotics. In fact, today, this afternoon, there will be a press conference downtown by the journal Nature talking about some very exciting new research about really being able to specifically block the toxins of anthrax. And I think that's something that we should pay attention to, because we're going to try and translate that and from the fundamental basic research to something that we can try in humans very rapidly.
I think my time is
Yeah.
run out. Is that right, Mr.
Yes,
Chairman?
thank you.
Okay.
Okay, thank you.
You're welcome.
Mr. Secretary, this